Hello everyone. In this quick 2-minute revision video, we'll be going over the section, Treatment and Management of Schizophrenia. From the chapter Schizophrenia, we'll revise through a series of questions and answers to help strengthen your understanding. Let's get started. 1. What are the differences between typical and atypical antipsychotics in the treatment of schizophrenia? Discuss their effectiveness and side effects. Typical antipsychotics first generation, for example, chlorpromazine, primarily block dopamine receptors, reducing positive symptoms, for example, hallucinations and delusions. However, they can cause serious side effects, including tardive dyskinesia, weight gain, and sedation. Atypical antipsychotics second generation, for example, clozapine, are generally considered to have fewer side effects and are effective for treatment-resistant schizophrenia. Atypical drugs block dopamine, but also affect serotonin, making them effective for both positive and negative symptoms. However, they may still cause weight gain and have other metabolic effects. 2. Describe how electroconvulsive therapy ECT is used to treat schizophrenia. What are the potential risks and benefits of ECT? ECT involves applying electricity to the brain to induce a controlled seizure, which is thought to reset brain activity. It's primarily used for severe schizophrenia, especially when other treatments, such as antipsychotic drugs, have been ineffective. ECT can lead to rapid symptom relief, especially in acute psychotic episodes. It can be especially effective for patients with catatonia or those who are resistant to medication. ECT can cause temporary memory loss, and there are rare but serious side effects, such as neurological damage or even death. However, modern ECT is far less traumatic than earlier versions. 3. Explain the role of cognitive behavioral therapy CBT in treating schizophrenia. Refer to the study by Sensky et al. 2000 to illustrate its effectiveness. CBT aims to help patients challenge distorted thoughts and develop coping strategies. It's often used alongside antipsychotic medication. Sensky et al. 2000 found that CBT was effective in reducing both positive and negative symptoms of schizophrenia. The study showed that CBT helped patients manage symptoms, like auditory hallucinations, by encouraging them to critically assess their beliefs about the nature of the voices they heard. This long-term improvement remained even 9 months after treatment. 4. Describe how do biological treatments, like antipsychotic drugs and ECT, compare to psychological treatments, such as CBT, in managing schizophrenia. Discuss the pros and cons of both approaches. Biological treatments, for example, antipsychotic drugs and ECT, are essential for acute management of symptoms. They reduce positive symptoms, but can cause significant side effects, like weight gain, sedation, and tardive dyskinesia. ECT can also lead to memory loss. However, psychological treatments like CBT focus on coping strategies and cognitive restructuring, offering patients the skills to manage their disorder. However, CBT requires patient cooperation and can be less effective during acute psychosis. When used together, these treatments can provide a comprehensive approach to managing schizophrenia. Dear student, just a quick note. This video is here to help you revise and learn through question and answer practice. Some of the questions and answers might not follow the Kaimark scheme exactly, but they're designed to support your understanding. Thank you.